recording? Okay. All right, so I'm going to read through the informed consent for the exercise test that we will perform today. You can choose to sign it or you can choose to walk away after I've read this to you, okay? The purpose and explanation of the test. You will perform an exercise test on a cycle ergometer or a motor-driven treadmill. The exercise intensity will begin at a low level and will be advanced in stages depending on your fitness level. We may stop the test at any time because of signs of fatigue or changing your heart rate, electrocardiogram, or blood pressure, or symptoms you may experience. It is important for you to realize that you may stop when you wish because of feelings of fatigue or any other discomfort. Number 2, attendant risk and discomfort. There exists the possibility of certain changes occurring during the test. These include abnormal blood pressure, fatigue, irregular, fast or slow heart rhythm, and, in rare instances, heart attack, stroke, and death. Every effort will be made to minimize these risks by evaluation of preliminary information regarding your health and fitness, and by careful observation during the test. Emergency equipment and trained personnel are available to deal with unusual circumstances that may arise. Responsibility of the participant. Information you possess about your health status or previous experience of heart-related symptoms, i.e. shortness of breath with very low activity, pain, pressure, tightness, heaviness in chest, neck, jaw, back, and or arms. With physical effort may affect the safety of your exercise test. Your promote reporting of these and any other unusual feeling with effort during the exercise test itself is very important. You are responsible for fully disclosing your medical history as well as symptoms that may occur during the test. You are also expected to report all medications, including non-prescribed ones, taken recently, and in particular those taken today, to the testing staff. Number 4, benefits to be expected. The results obtained from the exercise test may assess the diagnosis of your illness in evaluating the effect of your medication or evaluating the type of physical activities you might do to lower risk. Inquiries. Any questions about the procedures used in the exercise test or the results of your test are encouraged. If you have any concerns or questions, please ask us for further explanation. Use of medical records. The information that is obtained during the exercise test will be treated as privileged and confidential as described in the Health Insurance Probability and Accountability Act of 1996. It is not to be released or related to any individuals except for your referring physician without written consent. However, the information obtained may be used for statistical analysis or scientific purposes with your right to privacy retained. Freedom of consent. I hereby consent to voluntary engagement in the exercise test to determine my exercise capability and state of cardiovascular health. My permission to perform this exercise test is given voluntarily. I understand that I am free to stop the test at any point if I do so required. Okay, so I have read to you all 7 statements right here below. It's just saying I have read this form and I understand to the tests and procedures that I will be performing, and that the attendant risk and discomfort, knowing these risks and discomfort and having had an opportunity to ask questions that have been answered to my satisfaction. I contest to participate in this test. That's what that says there. So do you have any further questions before you sign?
Nope.
All right, it's free for you to sign.